Good morning. It is great to be back with you again. I love hanging out with you guys on Saturday morning and taking us along with you wherever you go, whatever you might be up to. You know, wherever you go, you're not alone. There are billions of little travelers who go right along with you. They live inside your guts. We're talking about bacteria, viruses, fungus, and they do a lot of good things for you and can also create some problems. So that's where we're going to focus today with our good friend Greg Russell from Fort Wayne Custom RX. He is the founder, pharmacist, and a clinical nutritionist there. Greg, great to see you again.
Yeah, great to be here again. You know, one common researcher said one time, he said, there's more DNA that's not ours that's in us than is from us. Yeah. Which, you know, tells you how extensive, how these affect our everyday life.
So we're talking here about the gut microbiome is kind of how it's referred to. And we've talked about that many times here on the program. But you know what? I keep seeing more and more and more research. And just this morning, saw a study that said if you have a particular microbiome mix, you respond differently to therapy for colon cancer than do other patients. It works better for you than it does for people who don't have that particular mix of bacteria. That's astounding. It's just one example.
It is one example. And, you know, we talk about how different cultures have different bacteria because of the different types of food that they eat. For example, Asians eat more certain types of plant foods. And, you know, there's a lot of research on the Okinawans having longer lifespans, and much of that's attributed to the types of food that they eat, or when they're transplanted one culture to another country, how their gut microbiome will change to that country's. And, you know, we just now know there's so much more. And, of course, a lot of this is because of all this DNA research that's been published, too.
Yeah, it's now easier than ever to take a look at that, just a small stool sample, and they can analyze and tell you exactly what type of bacteria you have and the mixture and a lot of other things. But we also now know that can be significantly affected by the drugs that we take. So that's where we're going to focus today, is those medications that can disrupt your microbiome. So what are some of those meds?
Well, you know, we've talked about some of them before. We talked about the non-steroidal anti-inflammatory drugs. We have talked about PPIs. We'll even talk about metformin. You know, we've talked about metformin having some different effects, too. And actually, it's pretty positive what metformin can do for us. But some of the things are not so talked about. For example, maybe antipsychotics will have an effect. And they all work kind of by different mechanisms. So it's pretty easy to understand how a PPI might affect it, you know, because we talked about the pH changing. Well, certain bacteria thrive in certain pH environments. So, for example, H. pylori bacteria, which is the bacteria that tends to give us those wonderful ulcers, those that gastroesophageal reflux disease. And we know that when we change the pH, make it more neutral or a higher pH, that H. pylori bacteria likes to really grow. And so we know some of these effects, but then some of them we're just now starting to learn from the research of how these things are affecting us.
So PPIs, just to back up a second, that is protein pump inhibitors. So those are the drugs that you might take for anti-acid relief.
Yeah,
right?
So there are definitely prescription strength antacids, such as, you know, ones that you're going to have to get from your doctor. And those babies are strong enough, they can completely turn off these proton pumps that secrete acid in the digestive system, especially in the stomach. So they are commonly used for ulcers on the prescription level, and also for esophageal reflux or Barrett's esophagitis, which is a disease that's kind of a prelude to a cancer of the esophagus. So those are valid reasons to take it, but you also have to be mindful that you can buy these things over the counter. And I can't tell you how many patients come in on day-to-day are taking these things quite frequently. And unfortunately, I think there's negative consequences when you take these things too regularly and you're not really watching, because they do work they're very effective. Right. They keep you from going to the doctor. But on the flip side, what's some of the downside of taking these things?
And some of that downside can be that it changes the bacteria mix inside you. And that's important because those bacteria do more than just digest food. What else is it that they are doing?
Yeah. Well, we've talked about how those bacteria really are communicating. They help your communication. And who are they communicating with? They're course, they're talking to themselves because they live in family groups, but they also talk to different organ systems. And probably one of the most important ones, of course, is the brain. So we know that there is a link to these. Unfortunately, we know that there's a link to the wrong type of bacteria creating some brain cognition issues.
And in addition to that, there's a link to depression and a lot of other conditions.
That's right.
So so we know that metformin, you mentioned that. If I'm taking metformin, what's an indication that I'm having some disruption of my microbiome?
Well, so metformin is kind of an interesting drug in by itself. We now know that it has what we call pleiotropic effects. It's not just helping blood glucose. I think you've had guests that have talked about it, increasing longevity, and some of the anti-aging proponents really love metformin. And so we know metformin has effects on the digestive tract, and part of that is probably its effect on blunting how sugar is absorbed and allowing it to ferment a little bit more and causing some disruption. And people sometimes can get used to that, and sometimes they can't, and we have to use other forms like a topical metformin to get around that. But we also know that metformin actually does some good things. It makes butyrate producing bacteria. And butyric acid, of course, is good for the colonic health. It's a short-chain fatty acid, and it's been shown that helps take actually inflammation down in the digestive tract.
Mm-hmm. Yeah, it helps support the growth of that lining of the intestine.
That's exactly right. It helps the colonic mucosa.
Yeah, if that's thin and breaks down, what's the harm?
Well, the harm is there starts to be links into things like colon cancer. And we want that colonic mucosa to be as thick and good as it possibly can be.
And we'll talk about that in just a second and what you can do about that. But there are other drugs as well. So something as simple as NSAIDs, the non-steroidal anti-inflammatory drugs we take for pain.
Yeah. So, what's really interesting, the University of Michigan did a paper back in 2016 where they actually started looking at these different NSAIDs, how they affect the microbiome. And they were looking basically at what type of bacteria were growing. So it's commonly known that certain NSAIDs are better for your heart health and other ones aren't. Naproxen, for example, it does not increase your risk of cardiovascular disease, whereas things like ibuprofen, chronic ibuprofen, can actually increase the risk of heart disease twofold. So, there's lots of different theories as to why that occurs. Part of it's because they affect these things called prostaglandin, which are anti-inflammatory, kind of subhormones, I guess I call them. But we also know that in they affect the bacteria makeup, and that some bacteria will produce, they'll break phosphatidylcholine down, which comes from red meats, and of course eggs and things like that. It'll take that phosphatidylcholine, certain bacteria will break those down to other chemicals, which then increase inflammatory processes, especially for the heart system. And we now know in naproxen, which is commonly called Aleve when you buy it over the counter, that type of medication doesn't do that. It shifts the microbiome away from breaking down phosphatidylcholine, whereas ibuprofen appears to shift it towards it. So again, kind of another indirect way of how these chemicals actually work.
So I find this just so interesting, and I neglected to mention earlier that Greg, of course, is here live in studio with us. If you have a question, you can always call 447-1190, 800-333-1190, or text your question to 46862. We've set the stage. We've kind of let you know that there are medications that can disrupt the microbiome in your gut. What can you do to support that? If you just can't give up these medications, what can you do to protect that microbiome? We're going to get into all of that as we continue with Greg Russell here on the Health Call Live Radio Hour on WOWO. And we are back with Greg Russell, the clinical nutritionist, pharmacist, and founder of Fort Wayne Custom RX at 425 East DuPont Road, Fort Wayne's. I think am I going to be wrong here by saying oldest compounding pharmacy? Or you set the trend here?
I'm probably the only totally compounding only pharmacy in Fort Wayne, but I'm not the oldest.
Okay.
There's been other compounding pharmacies.
Gotcha.
Yeah.
Let's jump out to the phones. Kent has called with a question for Greg about a viral infection that his wife suffered and is still having some consequences from. Go right ahead, Kent.
Hi. She had norovirus, and she had bad infection with C. diff before, and they finally got control of it. She had this, not the norovirus, but she had the C. diff infection for about 7 years, and it was pretty bad. She ended up in the hospital. Her kidneys almost failed because she had severe diarrhea and she couldn't eat. She had a fever. Anyway, my question is, she also has a bad back, and she takes pain relievers for that. And I was just wondering what kind of pain reliever would irritate her intestines.
Which one would, or which one would be best to take?
Oh, she takes Percocet for her back, and that seems to be okay. But she also takes Tylenol. So, when she doesn't hurt real bad, she'll take Tylenol then. And she occasionally has the diarrhea still, and she's due for a biopsy next week. Okay,
to try to determine what's going on with her GI.
Yes, exactly. Yes.
So is there something other than Tylenol that might be less irritative?
Yeah. So Tylenol is acetaminophen, right? So it doesn't actually fit in the NSAID class. So that one would be generally safe to take. Now, there is a caution, of course, on acetaminophen, and you're getting some in your Percocet. So you need to make sure she's really not taking over 3,000 milligrams a day, because we know that also will tax the liver. And she has enough issues going on there. Did they put her on any type of a probiotic?
No.
Okay. So we're going to talk about, treatment here in a second. So listen carefully to the probiotic, what I have to say about that. But yeah, there are some things that she's going to have to do as far as some GI repair, and we'll specifically talk to that too. And the reason for that is when she had that C. diff, that novavirus, she probably got some antibiotics, and we know the antibiotics can kill the bacteria in the microbiome. And so we typically, and now this is becoming very common, more recent in the last few years, to start taking probiotics when you're on antibiotic therapy and continue for a while after you're off antibiotic therapy. So, and for the C. difficile infection especially, we like the probiotic. It's actually a yeast probiotic called Saccharomyces boulardii. And again, if you feel like you'd like to call the store and talk to me, we can certainly sit down and we can go through all this, and I'll be happy to help you.
Yeah, Ken, I advise you. That's a great idea. So that's Greg from Fort Wayne Custom RX, and you can find that phone number on their website, which is customrx.com. We're going to move along, Kent. Sorry to hear about your wife's struggles. That's a tough one. It is tough indeed. C. diff is brutal.
Very brutal.
Some people can't get it under control with anything less than a fecal transplant. So they actually take microbiome from a healthy person and give it to the person with C. diff, and sometimes that's all that can really get it under control.
Yeah, it's really a scary disease. This was a disease that primarily occurred in hospitals years ago, and it would be from using these really high-potency hospital antibiotics. Well, unfortunately, in the community now, these antibiotics have gotten stronger and stronger, which means they're more selective. As they become more selective, they will certainly really sterilize your gut from some of these very good bacteria. And when the good bacteria get killed off, then the bad bacteria, C. difficile, is a toxin that's released from this. The C. difficile toxin is released, causes a terrible diarrhea, and this is the type of diarrhea that really can be life-threatening.
So you mentioned there that after antibiotics, probiotics becoming more and more common.
Very common, and again, as we learn more about probiotics, we can find some that specifically target certain type things. For example, women's vaginal health or bladder health. We can find some that help more the digestive health issues, or we can just have some that kind of help our overall immune system.
So in the case of Kent's wife and her challenge, you mentioned a particular fungus, though.
Yeah, Saccharomyces is actually a yeast. It's put in with a lot of different probiotics, but you can buy it individually. And in this case, we usually add Saccharomyces. Now, there are prescription drugs that have been used that are specific to the digestive tract. There are also antibiotics that are used, Flagyl or metronidazole, and, of course, vancomycin are kind of the two standard of care antibiotics that are used for that, too. And to be quite honest, for severe C. difficile infections, those have to be prescribed too.
Do I need to, if I'm on an antibiotic and I want to think about a probiotic, do I need a consultation with someone in your team?
Well, certainly they can, we have those easily available, and all you have to do is show up, and we're happy to talk to you. We always have a pharmacist available to talk to somebody.
Okay. And we're going to jump back out to the phones again. Let's get, go ahead, caller. What's your question? Hi, you're on Health Call.
Hello?
Yeah, go right ahead.
Yeah, a few minutes ago you were talking about ibuprofen and like naproxen with acetaminophen or whatever. I've been a chronic taker of ibuprofen for years. What would be an alternative for that? Because it seems like Tylenol doesn't really work.
Yeah. Well, you could maybe try to shift to Aleve, which is the over-the-counter product. I assume you're buying over-the-counter ibuprofen?
Yeah, just store brand mostly or whatever.
Yep. I would give Aleve a try. I think that is fairly comparable. On the nutritional realm, there are other anti-inflammatories like curcumin and boswellia we've talked about in past